Namaskar. Welcome to my YouTube channel. Today we are going to discuss about RRB Paramedical Nursing Superintendent previously related question answer. Part 7. Let's start. The first question: what is the standard nurse to patient ratio in an intensive care unit ICU as per many international and national guidelines? Option A 1:20, option B 1:1, option C 1:5, option D 1:10. The correct option is option B 1:1. According to IAP classification, grade 4 PEM indicates option A mild malnutrition, option B overnutrition, option C severe malnutrition, option D moderate malnutrition. The correct option is option C severe malnutrition. In obstetric nursing, Leopold's second maneuver determines option A fetal lie, option B fetal descent, option C fetal presentation, option D fetal back and limbs. The correct option is option D fetal back and limbs. The normal range for an adult's intracranial pressure ICP is option A 0 to 5 mmHg, option B 5 to 15 mmHg, option C 20 to 30 mmHg, option D 40 to 50 mmHg. The correct option is option B 5 to 15 mmHg. In a community, the first person to bring a disease to the attention of health authorities is called the option A primary case, option B index case, option C secondary case, option D carrier. The correct option is option B index case. A disease that occurs occasionally or irregularly is option A sporadic, option B endemic, option C epidemic, option D pandemic. The correct option is option A sporadic. Which of the following is a primary source of data in nursing research? Option A textbook, option B an encyclopedia, option C a direct interview with a patient, option D a review article. The correct option is option C a direct interview with a patient. Best practice to prevent mother to child transmission of HIV during labor. Option A vaginal delivery regardless of viral load. Option B administer nevirapine only. Option C maternal antiretroviral therapy and possible C-section. Option D no intervention needed if low CD4 count. The correct option is option C maternal antiretroviral therapy and possible C-section. What is the minimum daily dose of elemental iron recommended in pregnancy? Option A 30 mg, option B 60 mg, option C 90 mg, option D 100 mg. The correct option is option B 60 mg. Seckle experiment is related to which treatment method? Option A electroconvulsive therapy, option B insulin coma therapy, option C psychosurgery, option B behavior therapy. The correct option is option B insulin coma therapy. The hormone responsible for the fight or flight response is option A insulin, option B thyroxine, option C epinephrine, option D estrogen. The correct option is option C epinephrine. A BMI body mass index of 32 kg per meter square is classified as option A underweight, option B normal, option C overweight, option D obese. The correct option is option D obese. Obsessive compulsive disorder OCD is mainly associated with imbalance of option A serotonin, option B GABA, option C norepinephrine, option D dopamine. The correct option is option A serotonin. The therapeutic blood lithium level for a patient with bipolar disorder is option A 0.2 to 0.5 milliequivalent per liter, Option B 0.6 to 1.2 milliequivalent per liter. Option C 1.5 to 2.0 milliequivalent per liter. Option D 2.5 to 3.0 milliequivalent per liter. The correct option is option B 0.6 to 1.2 milliequivalent per liter. Which position is most suitable for a patient with severe breathing difficulty, orthopnea? Option A supine, option B Tendelbert, option C fallers or high fallers, option D prone. The correct option is option C fallers or high fallers. The primary purpose of a T-piece or bricks adapter is to deliver oxygen to a patient with option A nasal cannula, option B tracheostomy or endotracheal tube, option C simple face mask, option D venturi mask. The correct option is option B tracheostomy or endotracheal tube. In an ICU patient, a central venous pressure CVP reading of 2 cm H2O indicates option A fluid overload, option B normal intravascular volume, option C hypovolemia, option D increased right atrial pressure. The correct option is option C hypovolemia. Which hormone is produced by the placenta and helps in the development of mammary glands during pregnancy? Option A estrogen, option B progesterone, option C human placental lactogen HPL, option D relaxin. The correct option is option C human placental lactogen HPL. Which test should be routinely done in patient on lithium therapy to monitor thyroid auction? Option A blood urea, option B TSH and T4 or T3, option C liver function test, option D ECG. The correct option is option B TSH and T4 T3. Which isolation is required for a patient with pulmonary tuberculosis? Option A contact isolation, option B airborne isolation, option C droplet isolation, option D protective isolation. The correct option is option B airborne isolation. Thank you for watching. Please like and subscribe.